Hi, my name is Dr. Kirmani. Welcome to my channel, Patient Knowledge. This channel is all about health education. And today I'm going to be talking about cold hands and feet. Why do we get it? You must be wondering why our hands and feet get cold when it's chilly outside or when we are anxious. There are some other conditions that can give rise to cold hands and feet. We need to find out more about it. So let's get started. In this video, I will give you an overview on cold hands and feet. We'll be giving you some ways to warm up your hands and feet for people who work or live in cold places. We'll tell you about some of the medical conditions that can give rise to cold extremities, when one must seek medical attention, and what's the treatment. Some people may experience insomnia due to cold hands and feet, and I've got some suggestions for them as well. Now, our bodies are designed to regulate our temperature. When it's cold outside, your body makes sure to keep the blood flowing to your core and vital organs to keep them warm. This can alter the amount of blood flow to your hands and feet, making them feel cold. This is absolutely normal. What happens is the blood vessels in your hands and feet constrict when it's cold. This is to prevent heat loss from your core. The people who work or live in cold temperatures are meat packers, working in cold storage factories or warehouses, military personnel, mountain climbers, hunters, utility linemen, rescue workers, or people living in cold countries. They need special protective clothing to keep them as warm as possible. Here are some ways to warm up your hands and feet if you are one of them. Consider clothing choices. It's a no-brainer. Layering up yourself is handy in cold climates. Exercise daily to improve your circulation. Do a quick warm-up, like trying jumping jacks. Wiggle your toes and make circles with your feet. Make wide circles in the air with your arms to encourage blood flow. Move around regularly if you have a job that requires sitting for long hours. Take a short break every half an hour to 1 hour. Walk around or stretch your body. Use electric heating pad. For feet, use a heating pad on your lower back. This will open up the blood vessels and improve the circulation in your legs. Quick massage. Briskly massage your hands and feet. Keep warmers handy. Try single-use or reusable commercial hand and feet warmers. Wear mittens instead of gloves. Use heat with moisture. Use moist heat pads that you can warm up in the microwave. Remember, moist heat penetrates better. Avoid direct contact with frozen items and treat your hands and feet to paraffin wax. Apart from anxiety, cold weather, infections which can be viral or bacterial, chronic indigestion, and fluctuations in the blood pressure, and in the extremes of age such as babies and elderly where the body temperature regulation is not very well regulated, there are some other causes why you feel your hands and feet feel cold. These are some of the medical conditions such as anemia, problems with your arteries, called as arterial disease, which can be peripheral artery disease or primary pulmonary hypertension, where your lungs, the arteries of your lungs get affected. Can be diabetes, hypothyroidism, smoking, and vitamin B12 deficiency. Well, anemia is a condition where your red blood cells are unable to carry oxygen to the whole body, and this can cause cold extremities. Arterial disease, such as peripheral artery disease, is where it's a very common condition. Is where the arteries get hardened and they become narrowed, so the circulation is impaired, and this can cause cold hands and feet. Primary pulmonary hypertension is where the arteries of the lungs are affected. Diabetes can affect our body in three ways. It can affect the circulation, so the circulation becomes poor. It can cause heart disease, and It gives rise to nerve damage, especially if it is a long-standing diabetes. All the three contribute to cold extremities. Now, hypothyroidism is a condition where um, there is less of chemical called thyroxine in your blood, which is due to hypofunctioning of this gland. Now, this can cause impairment in the metabolism of the body and leads to cold extremities. Smoking damages the walls of the blood vessels and give rise to cold hands and feet, and vitamin B12 deficiency is one of the other cause of cold extremities. When to seek medical attention? You must see your doctor if you have noticed any of these. Any sores or ulcers on your toes and fingers that take longer to heal. Have you noticed any weight changes such as any loss or gain? Must see the doctor. Fever, joint pain or unexplained pain. Any skin changes such as a rash or thickening of the skin. These conditions need to be evaluated by your doctor. Now, what will your doctor do? He will take a detailed history to evaluate your condition, perform a thorough physical examination where he'll be looking for any nerve damage or will be checking your circulation, will order blood work to rule out other medical conditions like anemia, thyroid, any problems with other things such as vitamin B12 deficiency. Will perform an ECG to check your heart condition, and the doctor will check for peripheral artery disease. If it is present, will order for ultrasound to check the blood flow in your extremities. Now, what's the treatment? Treating the underlying cause will solve the problem. Anemia and hypothyroidism can be treated with medication. In peripheral artery disease, medication is given which will help to open the blood vessels. These are called calcium channel blockers. Now remember, peripheral artery disease needs to be detected early and treated to get a better outcome. People who experience insomnia due to cold hands and feet, here are some suggestions for them. Warm up your feet before going to bed. This helps getting a good night's sleep. Wearing socks helps to keep your feet warm. Give a pre-bedtime foot massage. This will improve the circulation. And use capsaicin cream, which is a natural circulatory booster. This can be used with your moisturizer. That's all for today. I hope this information about cold hands and feet was useful. Thank you for listening. If you wish to hear something about, leave it in the comment box below. If you like my channel, like, share and subscribe to my channel. Bye for now.